focus of the project is to provide welfare advice to people at the time when perhaps they're going through a major transition in their life which changes their circumstances. It may be a positive transition, perhaps they're having a baby but they're maybe having to give up work or reduce work, or they're having to maybe claim benefits for the first time to help with bringing up their child, and the cost of having a baby is very expensive nowadays. But also there's people who perhaps are diagnosed with long-term conditions which impact on their ability to work. There are people who are involved in a major trauma or an accident which then has a major impact on their life circumstances. So for them to be able to access advice at that key transition point before there's time for in terms of financial difficulties to arise. So it's a real preventative type of approach to ensure that they get advice right at the time they need it and before there can be any negative impact.
For people, but clinical staff in the past have perhaps been a little reticent about asking around financial issues for people because they didn't have the knowledge or understanding of the systems to be able to advise patients on either where to look for advice or to be able to advise them on the next steps for them to take. So bringing in a third sector organisation whose sole purpose is to negotiate the welfare system and provide that expert advice and support at a time when it's really needed seems like a really sensible way forward.
One of the challenges of working in a sort of partnership and quite a close partnership relationship with the NHS is that I do feel it is important as a worker from Citizens Advice that I do maintain some independence. I do always make it clear to people I'm working for Citizens Advice, but working in partnership with NHS, Lothian and with the hospital to ensure that we can offer you the right, the advice you need. But I am a confidential service, and but I can also talk to health staff on your behalf. But I will only share information with them which you want me to.
I would completely agree with that, and I think that was part of how we designed the project, that in fact we supplied funding to Citizens Advice Edinburgh to employ you as a worker of theirs. So you were very clearly not an NHS Lothian employee, and actually that was a purposeful choice in how the project was set up to provide exactly that independence and autonomy as a worker. That obviously brought with it its own challenges in terms of the fact that you're working in a health site, but you are not an NHS Lothian employee, and there were considerations around data sharing.
I think one of the ways in which we are working in a preventative way, in that we're sort of building awareness amongst the health teams within the acute settings about the impact of financial difficulties, but also about the impact of welfare reform. So I think that's sort of building the awareness and actually people feeling more confident.